So, first question. What was the process like of becoming a doctor?
It was one of a lot of hard work. You can probably know that one was coming. Um, you have to be you have to have a long-term focus if you're going to be a doctor. If you look at it from the very beginning and say, "Oh my goodness, 11 years of higher education," especially when you're just graduating high school, and it just looks like, you got more than a decade of training before you ever get out and become a doctor. It can be intimidating, but what you do is just keep a long-term focus and then take every day as they come, work hard, study and focus, and just stay on track. Don't ever lose focus of your goal. You keep working hard. Next thing you know, it's over. You're there, and now you're practicing medicine.
How did you feel about becoming a father?
That was it was quite a quite a joy. That was I think at the time of my life it happened, I had a lot of other things going on, but once you welcome a new one in the world, it just changes your focus. You can't just think of yourself or where you're going for your own goals. It's the whole family is coming along with you, and so it changes your perspective and makes you appreciate life a lot more.
What was your first real job?
My first real job. I had a very strange job when I was a junior in high school. I was working for the city of Carthage, and I worked with a state entomologist, insect doctor, and we mapped out all of the city's creeks and any standing water areas, and we came up with a plan of treating mosquito larvae and killing them. But we also had a drought that summer, so I didn't get to do as much work as I'd hoped to do. The next year, I worked as a groundskeeper for the park system baseball field upkeep. A lot of hard work. Made $3.35 an hour. It was very hard work. So that was probably my first real job, and it was one of those jobs you start at the very bottom, you work hard, work your way up. Even though it wasn't my first job, I will mention that before starting medical school, between finishing a Bachelor of Science in Chemistry at Ole Miss, having been accepted into medical school, but had about 3 months to go before medical school started, I decided to work as an orderly at the Leak Memorial Hospital, Carthage, just to get the flavor of being in a hospital, and that was also ground floor work and very interesting, and helped me to realize that I could work in a hospital or work in the medical field for a long time.
Now, what were things like at MEA, and how come you decided to switch over?
Well, MEA was a really good experience, especially in the beginning when I was working moonlighting as a resident. I was in my third year of residency. I'd done a lot of ER work in my second year of residency. We're talking about 88, 89, well, not 88, sorry, 1998 to 1999, but from 1999 to 2000, I worked with MEA. I got to work with Dr. Bill Howard. He's the fellow who was in all the commercials, who has the beard and a seasoned vet, and he worked with all the new residents to see how we were doing and whether we were up to snuff for MEA. I ended up meeting Dr. Loper later on, and we joined together. It was a great experience. I had a lot of patients sent my way, so I really got proficient at taking care of a lot of patients with a lot of chronic needs. And I did that for 11 years, and it was quite a blur. I worked a hospital. I did mostly St. Dominic. For most of that time, I was on call every other night, every other weekend, and I can just tell you it was a lot of hard work, but it went very fast. I decided after 11 years to make a career change and do hospital work full time, having just thought that through, and it was a big change, and that was also another interesting experience in my lifetime.
Now, what was life like at St. Dominic's?
It was very different from MEA. I started working primarily administration, although I did step back and do hospitalist work to keep some clinical expertise and to remind myself how hard the clinical physicians have to work. But I wore many different hats with St. Dominic. I worked as head of their case management department, which was a fairly tough assignment because it was very different from anything else I had done. I had to depend on a lot of other people in my 41-member department to help teach me the ropes, and Also some other very good department heads, especially with medical records. I learned a lot about coding and the billing and utilization review, and how the finance and billing side marries with the medical side. And then many times I had to step in with physicians to help guide them through the system. And sometimes that could be difficult, but it was rewarding. I had served as their interim chief medical officer on 2 different occasions over the next 7 years. I also was head over their big electronic medical record upgrade when they went from McKesson system to Cerner. It was a huge undertaking, and it was my job to make sure all the physicians were trained. That was once again, a very eye-opening learning process. Doctors are extremely busy, and to take something that is that they interact with every day and they're used to, and then switch it to something completely different can be very disconcerting, can inhibit their workflow. So I had to really go the extra mile to understand how all these other physicians in different specialties worked, so that I can help them make that transition as easily and painlessly as possible. And we were successful. So once again, a good 7 years with them, and it was something I look back with having once again learned many lessons.
So we understand that you opened up your new clinic, Face Value Health. What was kind of the process and thought into opening it?
In 2012, I went to a big update in Destin. Every year, the Mississippi Academy of Family Physicians has an update where we spend about 4.5 days or so in Destin. We do classroom work, lectures all morning to learn the latest and greatest in medicine. So in July of 2012, I heard a doctor named Dr. Brian Forrest, who is from North Carolina, explain his unique approach, which was really the beginning stages of direct primary care. I was intrigued. I read his articles in the Medical Economics magazine, and he had an article called Breaking Even on 4 patients a day. And he talked about a very low micro practice, low overhead practice, where you could eliminate a lot of the insurance and business oversight of your practice that can change the way the practice works. One of the big problems today with family medicine is it's mostly been co-opted by your large health systems, and they tend to see family medicine as a volume generator. The more people they can see, the more people can be sent into the system, and that seems to be a smart way to look at it from a business standpoint, but it's not always the best way to look at it from a medical standpoint, or from the physician's standpoint, or especially the patient's standpoint. So with this approach, it looked like this is the best of both worlds. This is a way that a physician can reclaim control of the practice and not have outside control stepping in and interfering with that doctor-patient relationship. So after 7 years with St. Dominic, I began really desiring a change again. So I knew when I stepped out at the end of 2017 that I would be doing this direct primary care approach. I talked around. There's another clinic in town that was just started doing direct primary care, but after some deep thought about this, I decided it was just best for me to do it on my own. So I opened Face Value Health in Ridgeland, Mississippi. And in fact, our opening day was June 4th, 2018.
And how does Face Value Health differ from other,
like your medical clinics? Yeah, like
money-wise.
Yeah, money. Oh, well, money-wise.
Yes.
Okay. Well, it's definitely it takes a lot of planning, and you have to plan on spending a lot less to begin with, because it's not something where you step in the current situation. If once a young doctor completes training and it goes out into the workforce, they usually go to work for a health system, sign an employment contract, and they're immediately making a good salary so they can pay back student loans and pay their overhead and all of that, because you'd go a long time without making very much money going through medical school and residency. So many of them are ready to start making a good salary right out of the gates. Well, with this, you have to build your practice up before you really make your income. So you have to have a long-term outlook as well. You have to have savings, or at least a very good loan. That can be a tough process for a lot of doctors. Now, I'd had over 18 years out in the workforce, so I had time to plan and put money aside, so I was prepared for the lean times, and now things are starting to build up and look much, much better.
How did you create the logo?
Oh, that was probably not very interesting, but there's a website called Fiverr. So I got on there, and I forgot how I heard about this, but I got on that website and saw some examples of several different logo designers, and I found this fella in Romania. I liked his work, so I sent him an email through Fiverr, and he agreed to do it. And so for $155, he created several logos. So I took two of the logos, and I took part of one, which that little fancy F, and I took part of the other one, which was the Face Value Health. I put them together and I changed the colors. The original colors he came up with were orange and navy blue, so I came up with kind of a light green and a forest green combination, a little bit of blue in there as well, and voila, we have our logo, Face Value Health. Yeah.
How did you create the system of Face Value Health?
Well, definitely there is already a good a network of doctors helping each other out in direct primary care. That's one thing nice about DPC or direct primary care is there's a lot of grassroots support from physicians to help out. So one particular physician, Dr. Umber in Wichita, Kansas, he and his brother came up with an electronic system called Atlas.MD, which has a lot of those components of managing a practice already built in, especially the billing system. So he had a lot of information that he and his brother sent me as checklists and other things that I needed to do to get the clinic to work. So I ended up using that template and following through, getting a lab company, setting up the system, the electronic system, getting computers, setting up my own network. Fortunately for me, I was already quite proficient at computers and electronics that I was able to do this without any real additional help, and I was able to save a lot of money doing it.
What current practices that other clinics may be doing that Face Value Health goes against?
Well, the big difference is I'm running my own practice, and because of that, I look at practice in general as the current traditional way of doing it. It's definitely a compromise. I mean, first of all, you have to deal with insurance companies, Medicare and the government, and their rules. Their rules are heavily dependent on you sending them data and on billing and coding a certain way, and those things take a lot of extra energy that you have to hire a lot of staff for. So because you have to hire all of that staff, the only way you can pay for that staff is to churn volume through. So now you're down to your 10 and 15 minute office visit. With that problem is that you can't stay on time. So patients have a 10:30 appointment. They get seen at 11:30, maybe later on, maybe 2 hours later. It can get that bad at some of the clinics, just depends on how much demand comes in that day. With our clinic, we decide to prioritize seeing patients on time, number one, and number two, spending the time that we need with our patients, giving them the access to us that they need to get to the bottom of their problems and feel like their needs are being taken care of. And we not only do that in the office, we offer email support as part of the membership, and we offer texting, so everyone has my cell phone. And that gives patients, when they really do need the doctor, they've got access to me. But it doesn't, the numbers I'm able to control, so I'm not having to see so many people in the office that I can't make good on my promise. I can make a decent income without having to plow through 50, 60 patients a day. Instead, I can see 10, 11, 12 patients a day and then deal with many other patients virtually and still be available to them without it being impossible to do.
Ever since it opened, how has the process, or how has the clinic been doing?
Well, as you can imagine, when we first opened, we tried several different marketing ploys and worked with some newspapers and sent out postcards, trying to get our name out there. But as you would expect, it started off very slow. I think we saw 2 patients our first day. I think the next patient we saw 1. The next day we saw 1, and we had a couple days where we didn't see anybody, and it was looking pretty bleak. But I did expect that, but it grew a little slower than I thought. So about 9 months into it, it wasn't looking very rosy. But then something happened in about March of last year. One day the phones just started ringing, and then they just kept ringing. and patients started telling other patients about us. And so we have now just every day we get new additions practically every day, and the clinic is doing very well now. It's one of those things you have to be prepared for if you do this type of practice, is that it's not for everybody. Direct primary care is a many people do have insurance, and they want a place that takes their insurance or takes their Medicare card, or they maybe the thought of paying a doctor a monthly subscription just doesn't sit well with them. But the ones whom it works for, they're ecstatic about it. They love it, and they wouldn't go back.
How has your life changed ever since you opened up the clinic?
Well, it's once again, it's like a third career change, going from a traditional practice with hospital and clinic to a hospital administrator / hospitalist role, to now being a direct primary care physician. It's really like doing three completely different things during my career as a medical physician. And it's definitely the flavor of the day is very different. It's been getting back to patient care and being beholden to your patients. It does it makes you have to work some long hours, and you have to be prepared to you can't just you're never really off, but at the same time the work is so much more rewarding. I feel every day that when I go in, I feel like I work hard, but at the end of the day I don't feel like I've been beat up like I used to when I was trying to get through 30-something patients a day. Now I actually feel still refreshed. I enjoy what I'm doing. I'm constantly looking for ways to improve patient care, increase my medical knowledge. Things happen in the clinic where that I research and learn new things that I didn't know before, or a new procedure that I previously wasn't able to do but now can do. And so mainly it's brought the joy back to medicine again.
And final question. Who are your biggest motivators?
Biggest motivators? I've got a lot of them. So obviously I've got my family, got my wife, got my girls. They're always encouraging me and really have been behind me the whole way. If they're not on board in the beginning, you really can't do this. My nurse Teresa she's been doing this a long time, about 40 years or so. She's been just a big motivator because she comes in every day. She wants to be there. She enjoys being there, and she's pleasant on the phone. She loves the patients. She loves talking to them, and that makes your day go so much better and gives you encouragement. I just have various patients come in every day and tell me how grateful they are that I'm doing this, and how when you just go about your day and somebody says, "Thank you so much. I've never had a doctor explain that to me like that," or a doctor was treated me so well, or just any compliment like that. You realize that you're doing the right thing and you're on the right path. So it's quite a motivator.
Thank you.
Thank you.